If you've been dealing with stubborn back pain that just won't go away, pain that sometimes wraps around to your side and into the front of your ribs, or even in the front of your stomach, there's a really good chance that the problem isn't your core or your disc. It actually could be coming from a small but powerful region called the thoracolumbar junction, where your mid-back meets your lower back. This area is one of the most common and most overlooked sources of back pain, and it can cause tight obliques, weak glutes. It can make bending or rotating nearly impossible. In this video, I'll show you how this problem presents, how to test it if it's really your issue, and what you can do to fix it. I'll share a real patient story that shows how quickly things can turn around once you find the real source. So let's talk about like the anatomy part of it and then what your symptoms that you typically would feel. So you have your lumbar spine. So we have our lumbar joints up through here, and then you can feel your ribs. So like here's the bottom of my rib is through here, and if I follow it through here, it's where the ribs come together with the lumbar spine. So it's usually like right in through here. The problem is that when that doesn't move and it gets stuck, what happens is you'll feel it all along the side. You can feel it in through the front through here. You may not even notice that you have some tightness in through the front, and I'll explain why here in a second. You'll notice that like you just can't even get the hip to fire. You may have some tightness in the front because it all just kind of works from the compensation of what happens. And so the big things that can cause something like this, I've had this happen to me, is injury. So like for me, I was on a moped, hit a curb, threw myself up in the air, threw the moped away, and then rolled on this side on cement. And so that's where mine all started. And so I got most of it like solved, but from the injury, I still have always had tightness, like right in that lower part of the spine. Other areas that can happen where if you've been like pregnant and you had a C-section or you had surgery down for like fibroids or something, even like a herniation, anything through there in the front, what can happen is you can just get some like adhesions and scarring, and so that starts working its way. These, the obliques all go in and attach in through where the lower part of the ribs are. So if something's not moving through here, it's not gonna let the ribs move, and so the joint could be, maybe the joint's not the problem and it started from surgery through here. In my case, it was an injury, so it started back here and it moved its way in through the front part, the obliques, the abdomen, all the muscles in through here, all those were tight on me. And the issues in the front part of my leg, and it all stemmed from my injury that I had. Other things that could be is if you like repeated motions of doing something. So maybe you're always like rotating. You're always like you're sitting and rotating and looking and doing stuff on this side. That can also just being in those positions for so long, your joints just get stuck and kind of scarred down. And so those are all problems that can happen. Now, things that we see, symptoms that we see as a clinician, we'll notice that like you just can't bend backwards. Like, you know, for me, it's like I could bend on one side, but if I tried to bend on the other side, I couldn't move. And so extension ends up being an issue. Rotation ends up being an issue. You can rotate all the way on one side, but you can't rotate on the other side. So that's when we start noticing like, oh, if that's an issue, we're starting to think maybe there's some stuff with the thoracic spine that's creating some of your back pain. Other things that we'll notice is they can't get the glute to fire. So like the back won't even want you to extend to even get this to fire. So they'll be super weak. So you can go in and strengthen all you want, but if you don't solve why it's happening, then that's gonna be a problem. Other things that can happen a lot of times, again, you'll get tightness all in the front because you can't get up through the hips to fire. So then what happens is you'll get the quads to fire. Some of that's all because of if this starts getting tightened through here, all the muscles up and through here also attach into that pelvis. And so it starts taking over because of things that are happening back here or in the front. So you really have to look at all these things. So areas that you can look at again, just see how you are at rotating. See how far you can rotate. If you're noticing like, I just can't go this way versus I can go this way, that's gonna be a clue. If you're noticing some of these symptoms, that's gonna be a clue. You can even do a self-assessment where you lie and you can go in and just see like how far can you go down. And if you're like, oh, that hurts, there's probably some adhesions that are happening that we need to address. So you can go on one side and the other side's like, wow, I don't go down as far in through here. And so you're going to get some adhesions in through those obliques and abdominal walls and deeper muscles because of things that have happened, whether you've had an injury or you've had a surgery, those kind of things. So we've got to solve these problems. So how do we treat this? Well, it comes down to an evaluation, and we've got to figure out, is the back a part of it? Like the thoracolumbar joint, is that where some of this is coming from? Or is it coming from the front? Or is there a combination? So we address all of it. And the fastest way that we've been able to address it is using shockwave therapy, because we can knock out like that area gets so tight and stuck. Like, I can't tell you how many times I had my staff treat me in that area, doing mobilizations and releasing some of the tightness that was happening through there. And it just would be short-lived. Like, I was able, it was fine. But once when we went and did shockwave and like went through there, knocked it out. We literally had a patient, the same symptoms of like, oh yeah, this is where it's coming from. And we just did shockwave through just the thoracolumbar part, like back in through here, like went, I mean, you could feel it. It's not moving. Went and like worked shockwave all in through here. All of a sudden, she could get her glute to fire. Like, we could hold the leg up and she could actually hold it, where before it was like, nope, nope, nope. It's the body's baby compensation saying like, nope, if I do this, it's gonna hurt, so it just won't even allow you to fire those muscles. And so we're working all in through here, all in through here, and all in through here with shockwave to start getting her some results to her back pain that she's had for years. And so again, you've got to figure out these pieces. This is not something that's coming, the back pain is coming from the disc. We've already ruled those things out. This is not back pain coming from the hip. The hip actually moved for this patient really well. And so when you get to a place that can kind of figure out all these symptoms, you're going to feel great. You're going to feel like, oh gosh, I'm not going to be hurting into my 50s and 60s. I can feel great and feel confident that I can stay active as I age. Like, that's our goal for everyone, as well as don't think that, oh, I'm 60 and nothing can happen and I can't get better, or I'm 70, or as my mom, she's 80 and she was starting to think some of these things. We're like, no, 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 we can help you feel like, if you're 70, 80, feel like you're in your 40s and 50s. If you're 40 and 50 and you're feeling like, what am I going to feel like when I get into my 50s and 60s? No, we can solve that problem for you. We can get you feeling great as you age. We have so many different tools to help you do that. But the first piece is figuring out what's going on, where we need to address it, solve your problem, so that we can get you back to feeling amazing. So if you have back pain that keeps coming back, or tightness that wraps around the side, don't ignore the thoracolumbar junction. It just might be the missing link in your recovery. If you're in the Dallas area and you want to find out if this is your problem, click the link below, schedule a discovery visit at mPower Physical Therapy. We'll help you find the real source of your pain. And if you found this helpful, hit the like button, subscribe, and share this with a friend who's been doing endless core exercises with no change because it might not be the core at all.